what he makes of it. Dean, a very good morning to you.
Good morning, Mike, and Happy New Year to you and your team.
Yeah, Happy New Year to you as well. Tell me, what do you make of this? I mean, it seems to be, you know, once again, an awful lot of gobbledygook, an awful lot of kind of, this is what we're going to do, this is what we plan to do, this is what will happen. Not actually anything concrete, for example. I don't know when they're building these community hubs, where they're going to be, how it's going to work for you guys as GPs.
Thankfully, Mike, I know a little bit about it because actually none of this is new. We might be in a new year, but there are no new ideas here. These community diagnostic hubs were actually brought in by the last government. We've had them for several years already, and it's essentially where your local hospital has an outpatient department somewhere closer into the community, closer to you, rather than in the main hospital body building. So your GP can refer you there to have tests done rather than having to go into the main hospital.
Okay.
So there's nothing new there. That's been around for a few years.
So is that like a sort of walk-in centre then or something?
Well, yes and no. In theory, it's closer to you. It's easier to access. The transport should be better, but it's not a walk-in service. You need to be referred to these different hubs, either via your GP or via the hospital. So it is kind of like just being referred for a test, just like you would have been done to a hospital in the past, but different buildings, same people.
Right. So if they're already there and they're already operational, how is their introduction actually even possible, and how is anything going to change then?
Well, the way that this can be spun is that they're not all there yet. And in theory, they're not all on stream. So a lot of the places have been selected, a lot of the buildings have been made, but they're not necessarily yet up and running. So although they've been ready to go for a couple of years, some of them are not necessarily yet up and running. So you could say, you know, in theory, that a few million appointments are going to be created by having these functioning. But the question that I would then ask is, well, who was doing these tests before? Because this isn't new staff. This isn't necessarily new equipment. It's just the same test being done in a different place. Right. So I don't see any genuine extra capacity here. Yes, it's easier for patients because you don't have to go to the big building in the middle of the city. It's definitely easier for commuting, but I don't see any new appointments here.
No. And also their big plan, which is to get people's waiting list time down, which apparently is something they want to do over the course of the next 4 years. So by 2029, you won't have to wait more than 18 weeks. I mean, it's almost impossible for them to make that promise at this level, isn't it, at this stage? Because apart from anything else, in 4 years' time, there's going to be a lot more people here.
Yes. Again, this is capacity and playing with statistics. So let's say, for example, if you have a huge waiting list down in London for perhaps a year, and maybe there's half a year waiting list in York, and you get to choose and say, well, I'll go to York because York is faster. Well, York's waiting list will go up a little bit and London's waiting list will go down. So the waiting lists across the UK will even out. But again, there's no new capacity there. It's not necessarily that everyone is benefiting. It's that some areas will benefit and some areas will lose out because there's no new capacity being created as far as I can see in these headlines. So unless the government is planning to find some new clinicians, some new hospital beds, even some new hospitals, I don't see any new capacity being created here.
No, I mean, they talk about cancelling a lot of needless operations and needless appointments, but again, what do they mean by that? And surely if they're needless appointments, they don't need to cancel them because they shouldn't be being made in the first place.
Yes, you know, we've seen this over the years too, rationing by the NHS, and we have to be very open and honest about this. This is the NHS saying, I'm sorry, but we don't think it's worth spending the cash on you for this problem. And this might be, for example, if you've got a swelling and a lump that's bothering you, it's not necessarily shortening your life, but the NHS might say, well, that's quite expensive. Somebody else needs that operation, so we're just not going to do that for you. So this is a way of rationing different types of access to healthcare. We already do that on a large number of health problems. It looks to be getting worse into the future. But honestly, we probably should have that conversation. Should we be cutting off lumps and bumps because it feels wrong for you when somebody else is waiting for a knee operation? Actually, we do have to have that genuine conversation because there just isn't the capacity and resource to go around for everyone.
Yeah, no, I couldn't agree with more. Well, good to talk to you, Dr. Dean. It's ever common sense personified. Dr. Dean Eggitt there, GP, CEO of Doncaster's local medical committee. Well, guess what? Keir Starmer's big idea. Let's open some new regional hubs. They're already there. So it's not his big idea at all.